very good afternoon to all. So, sir, I am Rupesh, and the regional sales manager based at Delhi. So, it is our pleasure to introduce for this Lupin Suraksha education program. At Lupin, we are very committed for the providing the high quality of medicine and providing for the patient's care and increasing the awareness for the pharmaceutical field. And today we are here to discuss a very crucial topic, better practice for insulin storage and the correct insulin techniques. Because as you know, during this is the insulin technique is very important and the better practice is very important an important part also. So this is an area that has the direct impact to the patient health as well as the well-doing, especially during the during the warmer month and the while the patient is traveling. So we have announced here Mr. Salvio is the community pharmacist in the healthcare advocate, an expert in the pharmaceutical field, and as a senior member of estimate organized of the Indian Pharmaceutical Association as a leading body of the pharmaceutical present across the India. So what that I would like to hand over the session to the Mr. Salvio. So sir, session is hand over to you.
Thank you, Rupesh ji. A very good afternoon to all of you. It's a very rainy day. I'm in Goa, and actually a red alert has been declared. I hope all of you all are safe, just like I am safe. But first of all, before I proceed, on behalf of all those who are attending, I would like to say a big thank you to the Indian Pharmaceutical Association for inspiring this presentation on a topic which is very, very important for the healthcare of our great nation. Also, I'd like to say thank you in advance to Blue Tree Health Solutions and to Lupin, of course, for making this presentation possible. Now, India, as we know, is facing an epidemic in diabetes. And 11.4% of our population is diabetic. That means 1 in every 9 persons suffer from diabetes. But more than that, what is very concerning to all of us, those involved in the healthcare industry, is that young people in the age of 20 to 30 are now getting diabetic. So this is a very serious problem. Many of them realize this, that they are diabetic much too late, by which time sufficient damage to their organs has already been done. And also, there are a lot of undiagnosed diabetics that we come to know when we organize camps, etc. in our village and in Goa. So, uncontrolled diabetes is a life-threatening disease that affects the heart, kidneys, eyes, circulation, nervous system. And besides that, in combination with high blood pressure, leads to a definite reduction in the lifespan, in the life expectancy of the people. There are two issues here as far as diabetes is concerned that I see. One thing is people don't know about the seriousness of diabetes. So they are very casual in whatever they do, they take it very laxly. On the other side, there are people who take diabetes like a death sentence, and they are so scared that they stop enjoying life. Now, it is possible to enjoy your life even though you're diabetic. I mean, there are so many personalities. Say, Kamal Hassan, Anil Kumble, they're all diabetic patients, but they are doing their best. There are many actresses also. Ruth is there, and so many other people. So they are enjoying their lives even though they are diabetic. They are doing this by, changing their lifestyle, changing the diet, their exercise, doing meditation and different things like that. So what we need to do is educate people about diabetes. And I'm very grateful again to the IPA and to Blue Tree Health and to Lupin for allowing me to make this presentation to all of you. Zil, can you see my screen?
Yeah, we can see your screen. You just have to go, slide,
Yeah,
do
go
the
ahead.
slide. So,
Yeah.
yeah.
Okay. Wonder. So the topic, as we know, is better practices for insulin storage during summers and travel, and correct injection techniques. So this is the table of contents. I won't go through the table of contents as we will not waste time. We'll go through one by one. Basics of insulin and diabetes. What is insulin? Insulin is a hormone produced by the organ pancreas. It moves the glucose from the body into the body cells for energy. Insulin also helps balance your blood glucose levels. Now, how does it work? Insulin is the key that opens the door of the cells so that the glucose can leave the blood and move into the cells. As the picture shows here, what insulin exactly does. Moving on, role of insulin in diabetes. When the pancreas doesn't make enough insulin or the body doesn't use the insulin properly, glucose builds up in the blood. This leads to high blood sugar and diabetes. Now, there are two main types of diabetes. Type 1, or which is called the juvenile diabetes or juvenile onset diabetes. It occurs when the immune system mistakenly attacks the pancreas and the pancreas stops producing insulin. This often happens in young people. And then you have the type 2 diabetes, which is also called maturity onset diabetes. It occurs when the body cells don't respond to the insulin, causing high blood sugar levels. This is also called as insulin resistance. Now, insulin therapy. Insulin therapy acts as a replacement for or a supplement to the body's natural insulin. It can help in both types of diabetes. People with type 1 diabetes can't make insulin, of course, so they need supplemental insulin to control their blood glucose levels. They cannot take these, anti-diabetic drugs that are available to others with people with type 2 diabetes. Now, these people with type 2 diabetes may need insulin if they cannot control their blood glucose levels with oral medications. Now, sir, I can't see that. Synthetic insulin is manufactured in a lab using recombinant DNA technology. Now, this is being manufactured in India, and so there are so many companies that are making insulin, which is being used by India. Now, this is very important for us as pharmacists. Insulin requires strict cold chain standards. Now, this is a very serious issue. Cold chain standards. Why proper insulin storage is essential? Now, insulin is a hormone-based drug and temperature sensitive. It can be damaged and become ineffective when exposed to extremely high or low temperatures, resulting in the loss of blood glucose control over time. Thus, all insulin products must be stored at the proper temperature, that is between 2 to 8 degrees centigrade, to ensure that they remain safe and effective. Now, we have to understand that glucose, insulin, is a protein. It's a protein-based hormone. It's a peptide hormone. Now, it contains 51 amino acids, which are organized in 2 chains. Now, if you increase the temperature above more than 30 for a longer period of time, this protein gets denatured and the structure gets destroyed. Same thing happens if you freeze the insulin. So these are two very important things. You cannot subject the insulin to high temperature as well as to very low temperatures. So these are two important parts that we should keep in mind. Strict cold chain standards. Insulin is categorized as a cold chain product. Thus, it is essential to store and transport insulin products with a specific temperature range of 2 to 8 degrees centigrade to ensure its full effectiveness throughout the supply chain, from manufacturers, distributors, pharmacy, to people with diabetes. Now, suitable rigid containers, cool boxes, gel packs can be used during the transportation process to maintain the recommended temperature. A temperature log should be used to record the temperature variation so you know what the insulin has gone through during transportation. In the event of a cold chain breach, the medications must be discarded because it is very dangerous to use these medications. Best practices for insulin storage during summers. Now, as all of you all must be experiencing, and we are experiencing in Goa, we are experiencing global warming and climate change. In Goa itself, our temperature has gone up by, average temperature has gone up by more than 4 degrees centigrade. So it's very hot all throughout the time, and we have now lost the boundaries between winter and summer, etc. So this is a very important topic, particularly for the entire nation. Now, this is also another important part for us as pharmacists, storage of insulin at pharmacy. As the summer months are approaching, I mean, they're already here for us, it is essential to understand how to store insulin correctly, as extreme temperatures can affect its potency. Here are some recommendations which we can use in our pharmacies, all those who are community pharmacists, who either have their own pharmacies or are working in pharmacies. Insulin should be transferred to the refrigerator immediately upon arrival from the distributor. All insulin products, vials, pens, cartridges should be stored at recommended temperature 2 to 8 degrees centigrade. Never keep insulin in the freezer, deep freezer, or directly on ice. I must repeat this. I will tell you why I say this again. Never keep insulin in the freezer, deep freezer, or directly on ice. Do not use the refrigerator to store food, drinks, or blood, as it increases the risk of contamination and temperature fluctuations. Use an integral thermometer to check the temperature inside the refrigerator accurately. And for this, I would suggest that you maintain a temperature logbook, by which you log down the temperature in the morning and in the evening. The refrigerator for insulin should be defrosted every 6 to 8 weeks if it is not self-defrosting. Insulin storage tips. Efficient design. Refrigerators that are open on the top are more efficient than the vertical ones. Proper placement. Place the refrigerators at least at an arm's length away from the wall for proper air circulation. Storage restrictions. Refrigerators should be only 50% occupied. Room environment. Room with multiple refrigerators must have air conditioning or fans to maintain optimal temperature. Maintenance schedule. Perform regular servicing of refrigerators. And lastly, temperature monitoring. Integral thermometer should be calibrated annually to ensure that the readings are accurate. Also install an independently powered digital thermometer to record the current temperatures. Insulin storage during power outage. Now, this is another important topic. Steps to minimize damage to the insulin products. The time of power outage should be noted when the power outage started. The refrigerator and freezer doors should not be open during power outage. If the power outage continues for more than 24 hours, then transfer insulin to an insulated cooler bag or container with cold packs, not frozen. Please remember, not frozen, to maintain with the temperature. When the power is restored, the temperature in the refrigerator and freezer should be recorded and monitored until the temperature returns to the desired temperature. Medical fridge calibration. What is medical fridge calibration? Temperature monitoring is crucial to keep insulin in good condition. Medical fridge calibration is the process of verifying and adjusting the temperature settings of a refrigerator to ensure that it maintains the required temperature range to store sensitive medical supplies such as vaccines, medications, blood samples, biological materials, and insulin. The calibration process, of course, is performed by trained engineers to ensure proper procedure and accurate measurement are verified and recorded. Special tools for medical fridge calibration. Data loggers. They record temperatures variations over time, ensuring that the refrigerator maintains the required temperature range for storing insulin and other temperature-sensitive medications. Data loggers help in continuous and precise monitoring of temperature, logging of temperature data, and providing historical temperature data. Temperature control and alarm systems. These systems helps and provides alert to ensure that the refrigerator temperature remains within the required range for storing sensitive medical products such as insulin, vaccines, and other medications. These devices have more features than data loggers. The advantages are allows pre-programming of the temperature data, alerts users if the temperature goes out of range, and maintains optimal storage conditions. Another important topic, insulin transportation during summer. Transfer of insulin from pharmacy to home. Because insulin is temperature sensitive, it can become damaged as it is being transported, delivered in hot climates. Insulin needs to be dispensed with very clear instructions to the patient on how it should be transported at home. So the best practices for transporting insulin during summer months. Insulin should be transported safely without undue shaking and exposure to high, that is above 32 degrees centigrade temperature environments. Insulin should be transported from pharmacy to home in rigid containers to reduce damage to the medicines. Insulin should remain in its initial packaging to protect it from sunlight. An insulated bag or cooling pouch, something like this, is ideal for transportation of insulin to avoid sudden temperature variations. Transporting insulin immersed in water is equally discouraged as it destroys the labels on the insulin vials. Improvised storing, ways of storing and transporting insulin. As you can see that, you can do that with small containers. Place ice cube at the bottom, a layer of cotton, because the ice cube should never come in direct contact with the insulin container. Keep insulin vial on cotton, place another layer of cotton on the insulin vial and place ice cubes on the top. A transport box can be improvised by using a plastic box with the transportation of insulin from pharmacy to home. The ice will keep the temperatures favorably for transportation, even in the heat of the sun. The cotton acts as a layer as a cushion against undue shaking of insulin during transportation. Nowadays, ice boxes, of course, are available with sensors and temperature loggers that can accurately record the temperatures. Storage of insulin at home during summer. For individuals with diabetes who rely on insulin, proper storage is crucial to maintain the effectiveness and safety of the medication. Thus, a pharmacist should inform patients when delivering insulin about safe storage of insulin during summer. Here are some recommendations we pharmacists can tell our patients. Unopened insulin should be stored in the refrigerator at between 2 to 8 degrees centigrade. Store the insulin in the middle of the refrigerator, never in the vegetable compartment or in the door. Ideally, they should have a small box, a medical box, in which they store all their medicines so that they don't get mixed up with the other medicines and with the other food products and other things that we normally keep in the fridge. Never store insulin in the freezer. This has to be specified because people don't seem to understand, as freezing temperatures can also damage it. People just tell them, you keep it in the fridge, they'll say, okay, we'll keep it in the freezer. You have to tell them first only, please don't keep anything in the freezer. In fact, no medicine, any type of medicine should ever be kept in the freezer. Open insulin vials like these and cartridges can be stored at 20 to 25 degrees centigrade for 6 weeks and 4 weeks if the temperature goes up to 30 degrees centigrade. So normally whatever you're doing, whatever the cartridge that you're using or the vial that you're using can be kept outside the fridge or must be kept outside the fridge in a cool place away from sunlight. Insulin in use should never be kept immersed under water as it causes a high risk of contamination. Never expose the vials and the pens to direct heat or sunlight. Keep the open vials in plastic containers with cotton. This is an improvised way of keeping insulin and syringes at room temperature between 20 to 30 degrees centigrade. Insulin may be carried to work or school in the same containers. Precautions. Always read and follow the manufacturer's storage instructions and encourage your customers also to read the instructions. Check the expiration date before using and don't use insulin beyond its expiration date. Use a permanent marker to label when you open your vial and cartridge and when you need to throw it away. It can help ensure you use it before it expires. Do not use insulin if it has been frozen or exposed to high temperatures. Always inspect the insulin before drawing the insulin into the syringe. If the insulin contains white clumps, particles or crystals, or if the insulin has become cloudy or is a different color, don't use it. How to store insulin without refrigeration? In locations where refrigeration is not available, maintaining insulin efficacy becomes crucial, particularly in extreme heat conditions where the temperature varies between 35 degrees to 40 degrees and even more. Preservation techniques use alternate methods such as cooling jars, earthenware pitchers, or a cool wet cloth to help preserve insulin activity. However, remember one thing, these are temporary solutions to keep insulin within the appropriate range and prevent degradation and cannot be used over a long period of time. Traveling with insulin. How to protect insulin from heat during summer. Carry insulin while traveling in summer. Carrying insulin while traveling in summer can be a challenge. If you are traveling, use an insulated bag or cooling pouch to keep the insulin. It will help maintain the temperature even in hot weather. Be careful not to put it next to an ice block. You cannot put your insulin direct contact with an ice block so that it doesn't freeze. Insulin should be carried in a plastic container to prevent exposure to extreme temperature and sunlight. Do not keep insulin locked in a locked car or in the glove compartment. Temperature in closed vehicles may reach very high levels, above 32 degrees centigrade, which may decrease the effectiveness of the medicine. When you're traveling by plane, when traveling by air, keep the doctor's prescription and a letter on hand. Very important. Keep insulin supplies in cabin baggage or handbag. Never place insulin in the checked luggage as the temperature fluctuations can damage it. When you're flying high up in the sky, sometimes the temperature in the baggage goes below zero. Carry insulin in insulated bag. Keep insulin in the inner compartment and the ice gel pack in the pouch compartment. Traveling in hot climates, store insulin in a fridge if there is one in your room or in an insulated container. Now, very, very important, one thing that I must mention to you all, if you go and you don't have a fridge in your room and you give it to the hotel, whoever there at the reception or the room service to keep in the fridge, you must ensure that they don't put your insulin in the freezer. Because I have known this to happen. You give it to them, they take it and put it in the freezer. So either you go with them and place it in the correct place or you instruct them clearly. Now that part being done, we now move to another important topic. It's called the correct insulin injection technique. Importance of proper technique. Insulin is effective only if administered appropriately for optimal blood glucose control. Correct insulin injection technique is essential to minimize complications such as hypoglycemia, that is low blood sugar, hyperglycemia, that is high blood sugar, and lipohypertrophy, that is fat lumps under the skin. Patient surveys demonstrate that patients have many issues with insulin injection technique, highlighting the need for the effective patient education. I've noticed this personally in my pharmacy. The government sometimes in Goa gives people free pens and free insulin, and the doctors don't find time to educate them how to use the insulin properly. They are totally lost. And therefore, it is my duty and the duty of the pharmacist to explain to them how the insulin has to be stored, how it has to be injected and treated. Site of injection. 4 safe areas for the insulin injections. Sides of the thighs, backs of the upper arms, abdomen, and upper outer buttocks. As you can see there in the picture, it is shown front abdomen, front side thigh, other side of the abdomen, and front and side of thigh. Now it is very important here, when you're giving an injection on the abdomen, it should be at least 4 inches away from the navel, because at the navel area, it's a little hard, the flesh there, and therefore it is important that you keep it away from the navel. On the back and outer arm, upper and outer arm, buttocks, side of the thigh, and the other side of the thigh. Rotation of sites. Injecting insulin at the same spot repeatedly can cause inflammation, fat tissue, increase or scarring. It leads to poor insulin absorption and depot formation, which may affect insulin release. Therefore, rotation of sites, injection sites, is important to avoid complications. The same site should be used for at least 1 month and rotation be done within the same site rather than rotating to different sites with each injection. Each injection should be away from the previous one by a finger breadth. Now, injection devices. Injection devices, there are the vials and the traditional syringe. 1 second. Sorry for that. And the traditional syringe, which is available for this purpose. As you can see, this is a Lupin Lupicillin M30, which comes in a vial and you use a syringe. And you have the insulin pen. This again is a Besugine is a pen offered by Lupin. Beautiful pen here. And these are the needles, very fine needles, which reduce the amount of pain. And this, of course, is the cartridge, which is inside. So the traditional method involves drawing insulin from a vial with a syringe and then injecting it. And the insulin pen, it is a cartridge of insulin, pre-filled or replaceable. You get pre-filled pens or you get replaceable pens with a dial mechanism for dosage selection and for disposable needle for subcutaneous injection, 4 to 8 mm in needle length. Now, recommendations, how to do the injection. Preparation of skin. Swabbing of the skin with an antiseptic is not required. If the skin appears dirty, use plain water and allow to dry before the injection is administered. Patients should bathe daily. Care of the injection site. Patients on insulin should be instructed to visually inspect and palpate the injection sites before injecting to avoid lumps, swelling, and infection. Needle length. The shortest available needles, 4 mm for a pen and 6 mm for insulin syringe, are recommended for all patients to minimize pain and the risk of intramuscular injection. Intramuscular injection can cause unpredictable absorption and severe hypoglycemia. Please remember, again, the insulin has to be injected into the fat layer and not into the muscle, because injecting into the muscle allows for immediate absorption. Injection technique. Insulin injection involves 2 steps, filling the syringe and injecting. I'll just run you through this quickly. Wash hands, check insulin for lumps, crystals, or discoloring. Gently roll between the hands until uniformly cloudy. Never shake the insulin. Step 2, wipe the top of the insulin bottle with an alcohol swab. Pull the plunger down to let the units of air into the syringe. The units of air should be equal to the units of insulin that will be drawn. Push the air into the insulin bottle and leave the needle in the bottle. Step 5. Take the insulin bottle and syringe, turn the insulin bottle and syringe upside down. Be sure that the needle is in the insulin and not in the airspace inside the bottle. Pull the plunger down to get the right units of insulin in the syringe. Step 6. Look for air bubble in the syringe. If there are bubbles, push insulin back into the bottle. Start again from step 5. When you have the right insulin units, with no air bubbles, pull syringe out of the bottle. Push the needle into the skin at 90 degrees angle. Push the plunger to inject insulin. Count from 0 to 30 seconds before withdrawing the needle, and place the used syringe in a sharps container. Do not reuse the syringe as if possible, or limit reuse to a maximum of 5 times. Now, this is again one important thing that we should consider here is the disposal of these needles. Disposing of these needles in the dustbin is not a correct thing to do. We should find out ways and means of getting all these needles and materials incinerated. And so we should work. Maybe the pharmacist can collect all the used needles and then together give them for incineration. I think this is very important. Precautions. Inject insulin slowly and steadily. Wait for a few seconds before withdrawing the needle to ensure full dose delivery. Now, this is very important. Insert needle perpendicularly 90 degrees angle without pinching the skin for 4 mm needles. That is when you're using a pen. For longer needles like these, when you're using, pinch a fold to avoid intramuscular injection. In patients who are very thin or fragile skin, use pen devices with short needles. Do not slant the needle excessively. This can cause subepidermal injection, leading to poor absorption, skin tattooing, and scarring. If the insulin tends to leak from the injection site, put some pressure on the injection site with a piece of cotton swab for a few seconds. Do not rub. Please note, this is written in capital letters, very important. Do not rub. If bleeding occurs, apply a cotton swab with little pressure for 30 seconds. Now, just what I told you earlier, it's come disposal of the syringes and needles. Proper disposal is necessary to avoid needle stick injury and cross-contamination. Dispose of the syringe and needles in a sharp disposal or a puncture-proof container. Put the outer shield cap back on the needle before disposing it. Empty the sharps disposable container periodically in a bio-waste bin in a doctor's clinic or hospital. Actually, the pharmacist can take responsibility for this to make it life easy for the patients. So these are the references.
Thank you so much, sir. There are 2-3 questions that I will post in the chat box and you can address that.
Yes.
So I hope you can see the question in the chat
Yeah,
box.
I can see the question. You know, now you get special packages whereby you can take your insulin to places, far away places. So there are these packages that are available. I think some pharmaceutical companies are already supplying these packages. So you should consider using these with, these gels that allow you to take the insulin in places like Saudi Arabia and far away for a long distance travel. How to store insulin in hot weather without AC? See, one thing is that you have to store the insulin in the refrigerator, what is not being used. And the one being used, you have to store it in a cool and place away from sunlight. I think that should be enough. Rotating of the insulin has to be done between the two palms, gently, without no shaking. Just gently rotate. Just 5 or 6 times, just so that it mixes. Not more than that.
Thank you so much, sir. We are done with the questions. There is a request to all the attendees to fill the assessment form and proceed further that they will receive the certificate. Mr. Rupesh, would you like to?
Yes, hi Jill. Yes. Hi Jill, I'm there. I'm audible, Jill.
Yeah, you're audible.
Okay, thank you, sir. And I would like to thank you and thanks for the insightful and kind of the session with the sir. So from my side, it is done, sir. Will any question, anything as is remain? Still pending?
Yeah. Hello. Yes, thank you, sir.
Thank
Thank
you,
you so
Mr.
much.
Sabir Kumar.
Yes,
Thank you
yes,
so
sir.
much.
Thank you, sir. Thank you so much, sir, for your kind of time and for this wonderful session.
My pleasure. Thank you all very much for allowing me this opportunity to deliver this presentation. I have also learned a lot. You know, sometimes you think you know everything, and sometimes you forget. So this I was able to revise my knowledge and awareness. Thank you very much, sir.